Every child grows and learns in their own unique way. Some take their first steps early, while others wait a little longer. Some start talking in full sentences before age 2, while others need more time. And that's okay. Children develop at their own pace. But sometimes that pace seems slower than expected, and that's when we start to hear a phrase that can sound confusing or even frightening: developmental delay. Today we'll talk about what that term really means, how it's different from a disability, and why early understanding brings hope, not fear. The term developmental delay simply means that a child is developing skills, such as walking, talking, or socializing, later than most children of the same age. It's not a diagnosis in itself, and it doesn't mean something is wrong with the child. It's a description of how development is unfolding, a sign that we might want to look a little closer and offer extra support. During the first years of life, children pass through many developmental milestones. These milestones are grouped into key areas: motor skills, such as sitting, crawling, walking, and using hands; language and communication, like babbling, saying first words, or understanding simple instructions; cognitive skills, how a child learns, thinks, and solves simple problems; social and emotional skills, how a child interacts, shares, and responds to others. When a child is behind in one or more of these areas, professionals may describe this as a developmental delay. It's important to remember that a delay is not a label. It's a starting point for understanding. Every child's development is a bit different. For example, some toddlers might walk at 11 months, others closer to 18 months. Both can be perfectly normal. A developmental delay means that progress is happening more slowly over time, or that certain milestones are missing when we would usually expect them. Let's look at a simple distinction. If a child learns a skill just a little later but continues to make steady progress, we often call that a variation in development. But if a child is consistently behind in one or more areas and doesn't seem to catch up, even with time, that's when we speak of a developmental delay. Many parents ask, is developmental delay the same as a disability? The answer is not necessarily. A developmental delay is a temporary description. Some children catch up completely, especially with the right support early on. A developmental disability, on the other hand, is usually a long-term condition, like autism, Down syndrome, or cerebral palsy, that affects how a child develops over time. The key difference lies in persistence and underlying cause. A delay may fade. A disability is typically lifelong, though progress is still absolutely possible. So what causes developmental delay? Sometimes it's related to genetics or medical factors. Other times it's linked to premature birth, hearing or vision problems, or environmental influences, such as lack of stimulation or emotional stress. And in many cases, the cause isn't clear at all. What matters most is not why it happened, but what we can do next. When a pediatrician or specialist suspects a developmental delay, they might recommend a developmental assessment. This usually involves observing how the child moves, communicates, plays, and responds to people. It's not a test to pass or fail. It's a way to understand the child's strengths and needs. Early identification allows us to support development before challenges grow bigger. The good news? Early support works. Research shows that the brain of a young child is incredibly flexible, a quality known as neuroplasticity. With encouragement, play, and targeted therapies, many children make remarkable progress. For example, speech therapy can unlock communication. Physical therapy can strengthen movement and coordination. And simply spending responsive, loving time together can make a huge difference. So what can parents do at home? Start with the basics. Talk with your child, even if they don't respond yet. Play together. Movement and imagination build the brain. Celebrate small victories, each new word, each new step, each smile. And connect with professionals, early intervention teams, therapists, or educators who can guide your next steps. Remember, support doesn't mean pressure. It means creating opportunities for growth in a warm, loving environment. If you've recently heard the words developmental delay, it's natural to feel worried or even guilty. But please know you are not alone. And it's not your fault. Developmental delay doesn't define your child. It's simply a way of describing where they are right now, not where they will always be. Every child learns in their own time, and with care and attention, progress happens. Sometimes slowly, sometimes suddenly, but always meaningfully. Let's replace fear with understanding and confusion with curiosity. The phrase developmental delay isn't a sentence, it's a signal. It tells us, let's pay attention, let's support this child. Let's believe in their potential. Because behind every delay, there's still endless possibility. And behind every small step forward, there's love, effort, and the incredible resilience of a growing mind. If you found this video helpful, please like, subscribe, and share it with other families who may need hope and information. Together, we can create awareness, support early intervention, and celebrate every child's unique journey. Understanding brings hope, early support brings progress,